Friends, as I mentioned to you yesterday that there will be a new topic today. So today's topic is drugless therapies, which was mentioned to you last week as to how to optimize the health budgets of the federal governments, central governments, or for that matter the state governments or the provincial governments. Matter is very simple. If you use the drugs and medicines, there are side effects. So we are longing for a day when 525 therapies which are drugless, which have been innovated and located by doing a worldwide survey, we have come to the conclusion that all the 525 therapies which are drugless have no side effects and is very much beneficial. It has been in practice for the last several thousand years in the form of folk medicine or even the alternative medicine or complementary medicine or for that matter energetic medicine or polypathic medicine. So we have to understand the beauty and the salient features of drugless therapies. In this connection, as I mentioned, there are 525 therapies which has been located by doing a survey. All the 525 therapies are listed in this video. The way I am speaking side by side, you are seeing the list of therapies also, right from A to Z. For example, there can be a flower therapy or a bag therapy or herpetopathy or chiropractic, yoga, heart yoga, acupressure, acupuncture. So there are thousands. Out of that, we have located only 525 therapies which are meaningful and useful. So the beauty of this therapy is that the patient does not have a bias for a particular therapy. The hypothesis is the patients do not have a bias for a particular therapy. They want to get cured no sooner they have got indisposed. They don't want that I want homeopathy or Ayurveda or for that matter allopathy or anything. In that case, we have to ensure that the polypathic approach, where there are about 10-12 doctors trained in all the 525 therapies, will decide the line of action, which therapy to be used side by side and on priority basis first of all. That way it is possible. Now, in order to promote this, we have decided that all the 525 therapies will be in the e-format, and we are going to have a 525 therapy included by having a 525 volume World Encyclopedia to be published in the e-format, which will be maybe in the 1.5 million pages. So it will be a good help to the practitioners and all those practitioners who are in the conventional treatments like allopathy or homeopathy or Ayurveda, or for that matter Siddha and naturopathy, yoga and other therapies. They will also try to learn and optimize the benefits. So that way the encyclopedia will not only be useful, but so far the optimization of budget is concerned. Friends, the budget can be optimized in the way that if we want zero budgeting on health, except for having the infrastructure for hospitals, that is all right. But on medicines and drugs, there will be no budget at all, because these are drugless therapies, and that is how we have been benefiting thousands and thousands of patients worldwide. For that matter, we will have to have new type of treatment, like there can be a 30 or 40 acre compound where there may be about 5,000 cottages made, where the patients will come and stay in the one-room cottage, where there will be facilities for cooking and also attending the call of nature, like washroom and all that, and there they will be knowing as to how to do these practices and how to get the program implemented, by also understanding the plus and minus points, and also by adopting to those drugless therapies. Now the other point is preparation of a competent cadre. We know that unemployment is at peak. Now see the fun. If 525 therapies which are drugless, and if we produce about say 50,000 experts for our country and about 1 million experts for the entire world in the area of one therapy, then accordingly you multiply by 525, so millions and millions of young boys and girls can get jobs, who can practice in the rural areas as well as urban areas. So that will be a novel way of ensuring that the young boys and girls get absorbed by getting themselves skilled in the area of these drugless therapies, the alternative and complementary medicine, and also the parallel medicine, or for that matter polypathic medicine. The difference between the polypathic medicine and the drugless therapy is that through drugless we cannot say that we will use 2 therapies at a time. But polypathy means we can practice and implement the program of getting somebody cured, not only with the help of one therapy, but 2 or 3 or 4 or 5 therapies can be applied together. For example, somebody is doing acupressure and acupuncture, but nobody stops them from doing yoga or hot yoga. Accordingly, meditation. So many techniques, or for that matter magnet therapy. So we have to again ensure that evidence-based treatments and evidence-based collection of scientific information is done at the earliest, otherwise what will happen? The practitioners of the conventional therapies will be biased and they will go against it. So it is in fitness of things that before we start providing training to the young boys and girls, let the existing practitioners of allopathy or homeopathy or Ayurveda or Siddha or naturopathy, or for that matter any other treatment which is there in practice in India as well as the rest of the world, are motivated to endorse drugless therapies, and that they also acquire a capsule called, they undergo a capsule course to have an expert knowledge of these subjects also. Only then there will be an endorsement by them, and the government will be ensuring that yes, if there is a competent cadre, they will also be able to practice. For that we will have to have some modification in the medical practice rules, we will have to include the new therapies in the list of therapies which are approved by the Government of India. In the meantime, because these therapies are always natural therapies, no therapy is unnatural. So under the naturopathy, all 525 can be included. So there is no need of notifying it separately, but if the government wants, they can do it. So that way, it is going to be a win-win situation for the patients, for the public and the governments. Let us hope that this is implemented at the earliest in order to optimize the health budgets of the federal, state, provincial and the central governments. Thank you.